I'm Dr. Joe Esposito, and welcome to our podcast, For the Health of It. Remember to subscribe to our podcasts, and I'll help you naturally get well and stay well.
The information presented on this program is not intended to take the place of your personal physician's advice, and it is not intended to diagnose, treat, cure, or prevent any disease. Discuss this information with your own physician or healthcare provider to determine what is right for you.
Are you suffering needlessly? Dr. Joe can give you advice on how to naturally get well and stay well. Dr. Joe Esposito.
What we're talking about today are symptoms that you don't want to ignore. Because patients come to me all the time, and I've been doing this for 36 years, and patients come in to me and my doctors, and they'll say, Dr. Joe, I'm here for neck pain, back pain, shoulder pain, sciatica, headaches, and my team of doctors are really good at working on those cases. But then we'll talk a little bit more. We have a checkoff sheet when you come in, and they'll check off things like, oh, I'm bloated, or I have headaches, or I have anxiety or depression. And they say, well, that's not what I'm here for. And then we say, no. We want to get all the information from you because we don't want to ignore any of your health issues that we may have to address. So we're going to talk about symptoms that many people have, sometimes don't know who to ask, and that's why it's the Dr. Joe Show. Dr. Joe Esposito is here to answer your questions. So the number one thing we get, the number one reason we see pain, patients is pain, neck pain, back pain, shoulder pain. Again, my doctors are awesome at that. And we have offices in Marietta, Duluth, Stockbridge, and West Cobb in the Atlanta area. And patients always say, why didn't I do this sooner? Why did I suffer for so long? And chiropractic care is the number one treatment for back pain, most effective, least expensive treatment for back pain. The number two reason we see patients is they have digestive problems. And one of the things is they say, I'm bloated. And in fact, even yesterday, I was on Eric Von Hessler's show, and we were talking about digestion. We kind of go down a rabbit hole when I'm on that show. It's a lot of fun. And we talked about digestive issues, and Eric said, I feel fat sometimes? Am I actually fatter? And the answer is no, you're probably just bloated. And then we talked about food rotting in the colon. So if you follow my advice, if you eat a lot of fruits, vegetables, nuts, and seeds, chances are you're not going to have a lot of bloating, but everybody has digestive issues. Nobody gets away with it. And I was on a Dr. Oz show a while ago, and boy, he and I we had sat and talked for about a half hour right before the show, and it's really cool. I have a quote from Dr. Oz saying, I don't even use Google anymore. I just ask Dr. Joe questions. So Oz and I got along real well, and we started talking about digestion. We kind of went down a rabbit hole on digestion. And so most people have digestive issues. Most people pass gas 12 to 14 times a day, according to Dr. Oz. And so a little bit of digestive issue is not bad, but if you have a lot of bloating, it's usually due to a couple of things. Number one, the food is rotten in your colon. And I said that on a Von Hessler show, and they just picked up, rotten in your colon. I said, no, really, the food can rot in your colon and give off gases. But if you have bloating, it could be constipation. It could be you ate too much. It could be you have acid reflux. And with more serious issues, it could be an infection, could be inflammation, irritable bowel disease, Crohn's disease, colitis. So trying to figure out what causes digestive problem is a mystery. And a lot of doctors are totally lost with it, and they go, we don't know what to do. Go see Joe. Go see Dr. Esposito's doctors. They're better at it than we are. So we get a lot of referrals for that. So the one thing that I see a lot of is the stomach, which is supposed to sit below your diaphragm, can push up into your diaphragm. And if the stomach pushes up into the diaphragm, the whole colon is not going to digest food properly. That's the kind of the starting point of this, like a conveyor belt. And so if the stomach is up against the diaphragm, you might have acid reflux or heartburn. You might feel full if you have a lump in your throat. That's when you probably want to come see us, because my team of doctors are all trained by me to adjust or pull the stomach down away from the diaphragm. And I have this problem. And the first thing I see when I have this problem is I eat too much and I still feel hungry. I know my stomach's full, but I still want to keep eating. So that's one of the symptoms that I see, and I say it's time to get my stomach adjusted. Then I may burp a lot. I may have some acid reflux. And so it's time to come see us when you have that, because you want to fix that. Because digestive issues are a warning sign. They're telling you something's wrong. And we're talking today about symptoms you don't want to ignore. So if you have gas, bloating, diarrhea, acid reflux, heartburn, even bad breath, many times the food is rotting in the colon, the gases are exchanged into the blood vessels go into the lungs, exchange gases again, and a bad breath comes out. These are all signs you need to come see us so we can work on the stomach. When you eat too much, or food you're not supposed to eat, like alcohol, meat, sugar, dairy, coffee, soda, and artificial sweetener, you may have some temporary discomfort. But that may dissipate over time. But if it doesn't, you really want to come see us. One-time thing, easy to ignore, probably not that big a deal. There's another thing we want to check, and it's a valve between your small and large intestine. So food goes down your throat, ends up in your stomach. Your stomach digests food, passes it into the small intestine. Small intestine is all coiled up in the middle of your gut, kind of where your belly is, and it coils around. And then there's a valve, and it's right between your belly button and your right hip bone. And right between those two, it's called the ileocecal valve. And the ileocecal valve opens and allows foods to pass from the small intestine into the large intestine. Then it closes. The food is put into your large intestine. Water is absorbed. It's packed and passed out. If the valve is stuck closed, you get constipation. If it's stuck open, you get diarrhea. So many times we have to adjust not only the spine to open up the nerve supply to the digestive system, we have to adjust the stomach, pull it down away from the diaphragm, and we have to check the ileocecal valve. And we have to adjust that to get it opening and closing again. So with digestive issues, there's not only the nutrition component, which of course we're big on, but there's the physical component. So many of you have health problems, and the problem is physical, not chemical. And you're constantly trying to treat it chemically with supplements, with food, with medication, with drugs, over-the-counter stuff, prescription stuff. The problem so many times is physical, not chemical. And you keep trying to treat it chemically. That's why you're not getting the results you want. Sometimes it is chemical. I'm not against medication. We have a medical doctor on staff. I'm not against medication. I'm against unnecessary use of medication. And all my doctors, including my medical team, feels the same way. If we can avoid the medication, we will. If we can't, we'll utilize it. And we're not stupid. We want to take the advantage of everything we can. So with digestive issues, acid reflux, come see us. Whenever I eat a cooked meal, whether it's a big bowl of soup or it's stir-fried veggies or whatever, if it's cooked, I take Dr. Joe's digestive enzyme. I take one. And that helps my food digest, which is going to help break up, prevent a lot of the gas and the bloating as well. But as you get older, your digestive enzyme levels drop. And as the enzyme levels drop, we want to facilitate that. It's aging. It's part of the aging process. We talked about that earlier in a show. We talked about best foods to eat when you're getting old. Well, digestive enzymes are one of those foods you want to eat as you're getting older because it keeps you young. You break down your food more efficiently. So that's I have enzymes in my car, I have my house, I have my office. So if I eat a cooked meal, I'll pop a digestive enzyme, and boy, most people love it when I do that. But if you do have acid reflux, you want to come see us, and we can fix that too. Other issues, other symptoms you don't want to ignore. You're snoring. If you're snoring, that can be a big issue. Because what happens is, most snorers that I see, they're usually overweight, but the stomach is pushed up against the diaphragm. And as you're trying to sleep, you're breathing, the diaphragm drops down. As you exhale, the diaphragm moves up. Well, that's okay if you're standing up. But when you lay down, you don't have gravity assisting you. And so now that may be the reason why you're snoring. So many, many cases over the years, we adjust their stomach, and then we fix the nerve supply from the spine to their stomach, and the snoring goes away. Snoring is a symptom. It's telling you something's wrong. Losing weight, of course, works really well. You can sleep on your side instead of your back. There's other dental mouthpieces, all of that. But none of that treats the cause. The cause is almost always the stomach pushing up against the diaphragm and or a pinched nerve in the neck that goes into the throat. So if we can fix those two things in most cases and get you to lose weight, the snoring goes away. So once again, we're talking today about symptoms you shouldn't ignore. Snoring is one of them. It's not normal. Something's wrong if you're snoring. Now, sometimes you might be sick, have a stuffy nose, you'll snore, you breathe through your mouth. I mean, yeah, there's temporary things that may be going on. But long term, if you're a regular snorer, you probably want to come see us so we can try to get to the cause of your problem, not just treat the symptoms. And again, with acid reflux, digestive issues, they all kind of tie together. Most snorers have digestive problems. They have acid reflux. Acid reflux can be annoying, but it can also be dangerous. If that stomach acid gets into the esophagus, comes up, refluxes, that can eat away at the esophagus and cause ulcers, could even lead to things like esophageal cancer. Now, that's an extreme case. I understand that. But we want to get to the cause of the problem, not just treat the symptoms. So that's the secret there. If you're tired all the time, that can be an issue. Missing sleep could be an issue. Could be that you don't have good iron in your blood. Could be a thyroid issue. Could be chronic kidney disease. Could be liver disease. Could be cancer. So if you're tired all the time, we want to start digging a little deeper. The most common cause of being tired is there's a nutritional deficiency. And so what I do, keep my energy levels up, the minimum supplements I believe everybody should be taking are Dr. Joe's Super Greens and Dr. Joe's Essential Source. I had a patient a couple of months ago, young girl, and she came into the office, and I was near the front desk. And I work out of the Marriott office. We have Duluth, Stockbridge, and West Cobb as well. But I was at the Marriott office, and she sees me behind the front desk, and she's, come here. And she motions with her finger. And I said, what? She goes, I'm mad at you. I said, why? What'd I do? She goes, you didn't tell me something. I said, what didn't I tell you? I tell you guys everything. She said, you didn't tell me not to take Super Greens and Essential Source at night. I said, I didn't know I was supposed to tell you that. She goes, well, I took it the other night and I could not sleep. I was wide awake. I felt great. She goes, it gave me so much energy. So sometimes just Super Greens and Essential Source is enough for many reasons, but one of the reasons is it gives you energy. So I always take my Super Greens and Essential Source in the morning. I also take nitric oxide. Dr. Joe's nitric oxide support opens up the blood vessels and increases circulation throughout the whole body. So when I take my supplements, I usually take them in the morning. I'll take the nitric oxide. If I take it at night, I can't sleep. Now, sometimes if I have a really busy day, I'm doing a bunch of shows, television, radio, got a bunch of patients scheduled, I'm running around, running to other clinics, I'll take an extra one in the afternoon just to give me that little extra boost. B complex. B vitamins give you energy. So that may be something you might want to consider if you're tired all the time. And then Dr. Joe's adrenal support. So my energy protocol, we should probably put this on the website, Garrett. Super Greens, Essential Source, nitric oxide, B complex, and adrenal support. That's my energy protocol. Now, a lot of people do this and they come off their coffee and their tea, so they save a ton of money. And patients tell me all the time, Dr. Joe, I can't afford not to take your supplements. And the first time somebody said that, I said, I don't understand that. What do you mean? What it's doing is it gives them enough energy that they make it through the day. They don't have to drink coffee. They work harder. They make more money. They're better husband, wife, brother, sister, spouse, whatever it is, because they have the energy to make it through the day. And they say, I'm saving money because I'm eating less food, because when you're hungry for nutrients, not food, giving you energy. And they said, I'm just enjoying life so much more. Thank you for giving my life back, just with the supplements sometimes. Then you add the chiropractic to it to open up the nerve supply, get the body moving, get the energy flowing through the body. I can't understand for the life of me why everyone isn't getting chiropractic care, eating a good diet, and taking supplements. I don't understand it because it's such a better lifestyle. It's so much cheaper than anything else you're doing in most cases. You feel better. You restore youth. You have that youthful energy in most cases. I don't get why people don't do it. And the biggest excuse I get is, well, I got busy. Well, if you don't take time to take care of your health, you're going to have to take time to be sick. It's just that simple. It's going to break down sooner or later. So it's pretty amazing. And even staff members, when we hire them, sometimes they know a little bit about us, but not a lot. But then they start taking the supplements, getting chiropractic care, and they're just blown away. Like, wow, this is one of the perks of working here. I feel like a human again. Yeah, it's one of the perks of working here. So anyway, if you're tired all the time, it could be an issue. So I'd say let's do the supplements and get chiropractic care. We start there. If it's still an issue, we send you to our medical department and we draw some blood and we find out, is there a kidney issue? Is there a liver issue? Is there a thyroid issue? Is there chronic inflammation? And then we go ahead and fix it. Now, pain is exhausting. So if you're in pain, that may be why you're tired all the time. You're not getting a good night's sleep. So that's why a lot of people, when they get chiropractic care and pain management, because I'm the only chiropractor in the state board certified in pain management, and then we have a medical division, it's interventional medicine as well, and we get to the cause of your problems, people are just thrilled. We try to get to the cause of your pain, not just cover it up, and then they're able to sleep again, so they're not tired, and that kind of knocks that one off the list as one of the symptoms you never want to ignore. Again, insomnia could be from snoring, could be from acid reflux, could be from digestive issues, could be from too much stimulants. We try to get in there and fix it. Another symptom you don't want to ignore, bad breath. Now, there's two types of bad breath. One is a rotten tooth. The other one, it kind of smells like a bathroom. And that's when the digestive system is involved. The food is essentially rotting in the colon, giving off gases. Those gases go into the blood. They exchange in the lungs, and the lungs comes out the lungs. So if you have somebody with bad breath, you might want to send them over to us. Now, we can always get a dental checkup for them if you may have a dentist. If not, we work with some good dentists. So we can do a dental checkup. But if it's still that potty breath smell, chances are it's a digestive issue. and we could adjust the stomach, pull the stomach away from the diaphragm, and in many cases, that just solves the problem. Then we look at, is there something going on in the colon? Is it irritable bowel syndrome, colitis, Crohn's disease? Maybe you're allergic to wheat. Maybe you're allergic to dairy products and it's irritating the bowels. So gastrointestinal issues can often trigger bad breath. So you really want to come see us if you know somebody or if you have bad breath. And what's cool now is a lot of people are coming to see us because they're wearing masks and they're smelling their own breath. Dr. Joe, I had no idea I stunk this bad. Well, a lot of times people don't tell you. But if you know it's there, or somebody's bold enough to tell you that, you might want to come see us for that. And let's see if we can get to the cause of your problem, not just treat the symptoms. You can take mints and brush your teeth, but the problem is coming from the inside out. It's not in your mouth, it's in your gut. Same thing with garlic. When you eat garlic, and I'm Italian, when I eat garlic, whenever I see my mother, if I ate garlic even a day or two ago, she goes, "Whew, you've been eating garlic again?" Because the garlic exchanges the gases in the colon, it gets into the blood system, goes into the lungs, and comes back out again. So, yeah, it could be temporary. You ate garlic or something like that. That's one thing. But if it's a chronic issue, it's not a symptom you want to ignore. And that's what we're talking about today, symptoms you don't want to ignore. Let's talk about pain. Headaches, neck pain, back pain, shoulder pain. This can be a sign that something very serious is going on. And so if you have pain, chiropractic, most effective, least expensive treatment for pain. And we have offices in Marietta, Duluth, Stockbridge, and West Cobb. We do pain management, chiropractic, nutrition. We'd love to be your doctor. But sometimes it's more than that. So we can get in there and we might do some, maybe an MRI, maybe x-rays, maybe something more elaborate. We can send you out to our neurosurgeons or neurologists and do a little further testing. So we try to get to the cause of the problem, not just treat the symptom. And again, chiropractic, most effective, least expensive. Start there for pain. If it's something we need to escalate to care, we'll send you out for it. We have no problem with that. We have great relationships with MRI companies, American Health Imaging we use a lot of. And so we have a great relationship with doctors. In fact, most of the doctors I refer to, I on speed dial. I can call them up right now, a neurosurgeon friend of mine, and I'll say, "Hey, listen, I got this case. What do we do?" He said, "Well, it sounds like we should do this or this," or it sounds like, "Hey, treat him for another 6 weeks and let's see what happens, and then we can dig a little deeper." So we try to do the most effective, least invasive treatments on all our patients. But headaches can be a sign of a neurological disorder, could be a stroke, could be a tumor. Most of the time, it's not. Okay, so you want to come see us and let's see if we can get to that cause. We do something called PRP. PRP is platelet-rich plasma. We take your blood, spin out what's called the platelets, take the platelets and re-inject them back into the body in certain areas. Concentrated form of healing. So with arthritis, spinal arthritis, knee arthritis, shoulder arthritis, wrist, carpal tunnel syndrome, shoulder issues, many cases, PRP is the natural way to stimulate that internal healing. Erectile dysfunction works real well for that. Hair growth, spatchy hair. In fact, I had it done. And I was just at a studio, and one of my friends said, "Oh my gosh, you're looking younger every day." So PRP is one of those secret treatments that I use to keep myself young. But spinal arthritis, knee arthritis, women that have leakage, bladder leakage, they may have romantic issues. They don't have the romantic sensation like they used to. PRP may be the solution for that as well. So if you go to our website, drjoe.com, just go to the services tab and it'll give you a drop down. You'll see all the services we offer. We accept most insurances, car accidents, sports injuries. If you've ever been in a car accident, if the car was damaged, I'm going to venture a guess that you were damaged as well. That's been my experience. So you want to come see us right away. The longer you wait for a car accident, the more problems the insurance company almost always is going to give you. Why didn't you go to the doctor? I didn't have a car. Well, you should have went to the doctor. I mean, it's like a bad relationship. They argue with you, nonsensical sometimes. So you want to come see us as quickly as possible. We have chiropractic, we have medical, we have immediate appointments available. You can do it right online, drjoe.com. First visit is normally $375. We've reduced that to $199. That's an exam, x-rays, consultation, first adjustment, and then going over the x-rays on the second visit and a nutrition evaluation. Doesn't include blood work. It doesn't include the second adjustment. People come in, "Well, Dr. Joe said I'm getting..." No, it's not what Dr. Joe said. Dr. Joe never said that. So don't put words in my mouth. That's abusive relationship management. It's called claiming the truth. So we want to work on getting the body well as quickly as possible. So if you want to make an appointment, drjoe.com. You can book it right online or call us, and we'll get that set up for you as quickly as humanly possible. So we're talking about today symptoms you shouldn't ignore. And so pain, muscle cramps, these can be big issues. It could be that you're lacking magnesium if you have a bad diet, if you're eating the 7 deadly sins, alcohol, meat, sugar, dairy, coffee, soda, and artificial sweetener. You're not getting enough magnesium in many cases, so you want to up your magnesium. You want to decrease the 7 deadly sins. Because when you eat the 7 deadly sins, they're acids. And when you put acid in your body, the body has to neutralize those acids. The body uses calcium as its primary neutralizing agent. So if you're putting acid in your body, alcohol, meat, sugar, dairy, coffee, soda, artificial sweetener, the body is giving up calcium to neutralize the acids. Calcium is necessary for the nerves to work. It's necessary for the muscles to relax. And so if you're eating a bad diet, chances are you're depleting your body of calcium, and you're not putting calcium in, because calcium comes from fruits and vegetables, nuts and seeds. And so now that might cause muscle spasms. So I want you to look at muscle spasms as a symptom you shouldn't ignore. Many times we'll do muscle testing here in the office. I'll push against a muscle. Person goes, oh, my muscle's cramping. That's a really bad sign. I should be able to push against your muscle and it not cramp up. If it's cramping up, something's wrong. Is it a pinched nerve? Many cases, yes. That's where we come in to fix the pinched nerves. Is it a calcium deficiency, magnesium deficiency, too much acid? Is it a sign of something more serious? So we want to get to the cause of the problems, again, not just treat the symptoms. If you're losing weight, it's okay to lose weight, but if you lose a lot of weight really fast, you definitely want to get that checked. That's not something you want to ignore. Could be a digestive issue. I know a friend of mine, she was allergic to wheat and never knew it. And she said, when I was young, I could eat anything I wanted because I just had diarrhea all the time. It's a great way to lose weight. Not a good way to lose weight because you're not absorbing your nutrients. So once she realized she was sensitive to wheat, she cut out the wheat, got normal again. But it could also be something more important than that. If you've lost more than 10 pounds or 5% of your body weight in a span of about 6 months to 12 months, and you're not trying to lose weight, you really want to get that checked. So if you're dropping pounds unexpectedly, that can be an issue. It could even be a sign of cancer. Now, I don't want to get you scared. It usually isn't, but it could be. If you're gaining weight, that could be a sign of thyroid issues. It could be you're on birth control pills, corticosteroids. It could be an adrenal issue. So once again, if you're gaining weight and you can't figure out why, you might want to come see us as well. If you've lost your friskiness. Now, you get older, testosterone drops, that could be an issue, but there could also be other issues as well. Sometimes women are just overwhelmed or exhausted, and a libido is very much tied to emotions. Libido goes down when you disconnect from your partner. So it could be a sign that something's wrong. It could be a pinched nerve. Many times the nerves in the low back are being affected. That affects the colon, sex organs, and bladder. So there may not be the normal sensation like they're supposed to. And so with chiropractic care, many times adjusting the nerve supply in the low back helps with that as well. So if you have neck pain, back pain, digestive issues, arthritis, romance issues, many times we have the answer for you. So if you'd like to make an appointment, go to our website, drjoe.com, drjoe.com. We have offices in Marietta, Duluth, Stockbridge, and West Cobb, in the Atlanta area. We take most insurances, car accidents, sports injuries. Folks, if you're in a car accident, I'm on my knees begging you, get to us immediately. We will make time in our schedule for car accident cases. And first visit is normally $375. We've reduced that to $199. We're trying to do everything we can to stimulate not only the economy, but your health as well. So if you want to make an appointment, drjoe.com. If you have any questions, send it to us through the website, drjoe.com. Follow us on social media at Dr. Joe Esposito. That's your homework assignment. I'm Dr. Joe Esposito. We'll catch you next time. Thanks for listening to For the Health Bit. Remember to subscribe to this podcast, and I'll help you naturally get well and stay well. You can also listen to and call into my radio show live Sunday evenings from 7 to 9 Eastern Time on WSBRadio.com and on a WSB Radio app.